Good morning and welcome. It is truly an honor for the Cambridge Health Alliance to host this critical event to protect Medicaid. My name is Dr. Asad Sayah. I'm President and CEO of the Cambridge Health Alliance. And this is for our patients and communities. In Massachusetts, one of three citizens is covered by Medicaid. But as a safety net organization, it's more than 50% of our patients are covered by Medicaid. So this program is absolutely critical to the mission, to the reason that we're here, to the reason that we exist, to care for the communities that we serve, and for the patients that truly rely on us for every day, not only for their health care, but for everything that we provide them. We care for their social determinants. We care for them physically, mentally, psychologically. We care for their families, and we care for their communities. And Medicaid is absolutely an integral part of this work. It is my honor and privilege truly to introduce our Congresswoman, Whip Democratic. Did I get it right? Katherine Clark. She has been a tremendous supporter and friend for the Cambridge Health Alliance for many, many years, as she's been a tremendous supporter and an advocate for Massachusetts and everything we stand for throughout her career. I had the privilege to meet Congresswoman Clark a couple of years ago when she visited us with Congresswoman Nancy Pelosi. And we had a great conversation at that time. And at the time, Congresswoman Pelosi was the Speaker of the House. And she chose to come to the Cambridge Health Alliance because we are what we do, which is serve the communities that we serve. And today we continue with that mission. We really thank you for all your work and all your effort and your friendship and your advocacy. And without delay, I would ask you to go ahead.
All right. Thank you so much, Dr. Sayah. I am so excited to be back here at CHA and so outraged at the reason that we are gathered, which is these proposed cuts to Medicaid. And I want to thank Secretary Kate Walsh also for being here, the incredible providers at CHA, and we'll be hearing from a special patient, Sandra Valente. CHA really exemplifies what is at stake with the GOP proposed cuts to Medicaid. CHA provides not only critical access to health, but a lifeline for our neighbors. And all of that is being put needlessly at risk. This is a moment of immense anger and worry over the future, and we are witnessing an all-out assault on the basic right to stay healthy and to stay safe. This attack on Medicaid is an attack on the patients I met today, on moms and babies, on kids and seniors, on Americans with disabilities, and on our entire healthcare system. Republicans have passed a budget outline that takes Elon Musk's chainsaw to Medicaid. It targets the coverage of 142,000 people right here in my congressional district, in the 5th Congressional District. That's 23,000 seniors, 60,000 children. And why? Why are we here this morning? Because the billionaire donors who funnel money into their campaigns now want a return on that investment. They expect tax breaks, corrupt contracts, and they expect the Republicans to cut working people's health care to pay for it. The GOP may be willing to make this deal, but I can tell you the rest of us are not. We are fighting back, whether we're Democrats in Congress, governors, mayors, physicians, patients, and neighbors in communities like this across our country. This is a nationwide day of action, and the people are coming together to say in one voice that our health care is not for sale. Medicaid is America's single largest health care provider. Here in the Commonwealth, it is 20% of our hospital funding. We are talking about 2 million Bay Staters who can go to a doctor, have independence, dignity, have a safe pregnancy because of Medicaid. We are not going to stand by while Republicans relabel their health care waste. All of us are for creating greater efficiencies with our resources, making things work better for taxpayers. But this is not what we're facing today. When half the births in this country, 3 million military families, 37 million children, that's who they're going after with these cuts. And I keep thinking back to a mom here in Massachusetts who spoke out about how terrified she is about what a future holds with these cuts. Her son was born with spinal muscular atrophy. As challenging as it's been, his disability does not define him. He is a proud college grad and he works full time. He is embracing the joys and opportunities of life. Because he has the resources through Medicaid to get through the day. He's been on Medicaid since age 2. That's how his family afforded his wheelchair, the medical equipment he depends on, and the treatment he needs 3 times a year. The personal care attendants who help him live out every day. Medicaid just doesn't keep him alive. It allows him to live. Here's what his mom wrote. Without Medicaid, he would be lost. Without the strength to work, without the care to survive. Cuts to this program are inhumane. In our district alone, here in the 5th Congressional District, 20,000 people with disabilities depend on Medicaid. We cannot allow the inhumanity of this administration to destroy innocent people. Families who are fighting to keep a roof over their head, to afford groceries and a doctor's visit. Is this the new definition of what prosperity looks like in this country? We certainly hope not, and we're going to fight to make sure it isn't. This country was built and belongs to working people, not the billionaire class. This country deserves leaders who act like it. Leaders that believe the American dream is a universal promise, not an exclusive club. I'm in this fight to stop this assault on the American people, on the good people here in the Commonwealth. I am so grateful to each and every one of you for being here today, for the work you do, for your patience, and for the patients who have been so generous in bringing their stories. And it's my pleasure to turn over the mic to someone who fights every single day in her long career and certainly now in her position for the health and well-being of our Commonwealth, Secretary Kate Walsh.
Thank you, Congresswoman Clark, for bringing the fire today. And thank you to my friends at CHA, particularly Dr. Saya and his team, for bringing us together for this very important conversation today. Massachusetts, as you've heard us say repeatedly, is the home to some of the best healthcare in the country, probably the best in the world. And that's thanks to the nurses and doctors and pharmacists and therapists who do this work every day. And we saw that up close and personal here at CHA, the Malden Center, where we have family medicine and pediatric care that keeps kids and families healthy. A PACE program, which keeps our older residents living safely in their homes and their communities. And behavioral health and primary care knitted together, 2 areas that are priorities for the Healy Driscoll administration. Being here and seeing this care in action and hearing from the patients, it's just even more unconscionable that we have to talk about Medicaid, cuts to Medicaid funding of the magnitude that we're looking at with the GOP budget plan. The numbers this big in Massachusetts, probably $15 billion here in Massachusetts. It's just important to put those cuts in human terms. Nearly half the kids in Massachusetts rely on Medicaid or CHIP for their health insurance. Medicaid pays for 70% of the long-term care expenses in our state, whether it's people at home or in a nursing home. And as you heard, covers 50% of the people living with disabilities. And this is not a Massachusetts phenomenon. This is not a blue state issue. This is happening across the country. Every Friday I'm on a call with people who do my job across the country. It's kind of become a support group. But these problems are just as difficult in Kansas and Indiana as they are in Massachusetts. And states, frankly, don't know where to turn. And it's not just cuts to Medicaid. Think about NIH funding, that developed the cure for that patient with SMA. Think about potential cuts to SNAP, which provides food assistance to 1 out of 6 of our neighbors and family members here in Massachusetts, and more than 340,000 children. Governor Healy and I visited Boston Children's Hospital yesterday, and she talked about these cuts being proposed to fund tax breaks for some of the richest people on the planet. And we really do have to question what kind of values lead us to the position that we're in today. But here in Massachusetts, we know where our priorities stand. We know that we want kids to have the healthiest possible start in life. That's good business. We know that we want older residents, people with disabilities, and families to get the health care they need. It's not just the right thing to do, it's an investment, as I said. And the returns are to our community and to our economy are incalculable. Our state, we see this every day. We're a state of great hospitals, great educational institutions. Cambridge and and the places we can see right out this window are the envy of the world because of the biotech industry that's been built here. The federal dollars invested in Massachusetts generate even more economic activity, which enables our state to be a net contributor to the federal budget. That gets lost in all the rhetoric, I think. So we're so grateful to Congresswoman Clark and our Massachusetts congressional delegation for standing up for healthcare and jobs in our state and nationally. And now it's my pleasure to turn over the podium to Emily DeLong from the Mass Health and Hospital Association.
Thank you so much. It's an honor to be introduced by Secretary Walsh. My name is Emily DeLong. I'm the Vice President of Government Advocacy and Public Policy with the Massachusetts Health and Hospital Association. And for those of you not familiar with our work, MHA serves as the leading voice for hospitals and health systems across the Commonwealth. Many thanks to Whip Clark and Dr. Saya for welcoming us to this event today. I'd also like to thank the Whip and the other public officials with us, Secretary Walsh, as I noted, Mayor Christensen, members of the local state delegation, for their fierce support of healthcare providers, workers, and patients. At its very core, healthcare is about humankind, the patients receiving care and the incredible people who deliver that care and serve their neighbors in their greatest time of need, regardless of who they are or their insurance status. This fundamental mission becomes impossible to meet without adequate Medicaid funding. It is the foundation that our entire system is built upon. Massachusetts leaders understood this when in 2006 they came together to enact our landmark law to expand access to health insurance coverage for all of our neighbors. And the Medicaid program is the foundation, again, of our communities, our entire system. It's what truly makes Massachusetts not just a state, but a commonwealth. And this has come up multiple times today in our conversations. We asked our member hospitals to give us an honest look at what cuts of this magnitude would mean. The responses were gut-wrenching. Every hospital and health system would be weakened by what is being proposed in Washington. Every healthcare worker would feel the strains. Every patient would have fewer local care options available and see the cost of their healthcare rise. For some Massachusetts hospitals, upwards of 75 to 80% of their patients are publicly or insured or uninsured. Medicaid is what helps to keep the doors open, is so deeply ingrained in all of their institutions' budgets, and makes the provision of care possible for all of their patients. Our hospitals worry about the crucial services that could vanish if Medicaid is rolled back. This program is the key that unlocks countless primary and preventative services, maternal and elder care, chronic disease management, and supports for critical needs like housing and food security. Our hospitals are already struggling to stay above water, as you know, especially in the wake of Steward Healthcare's bankruptcy and a pandemic with ripple effects that are still impacting every part of healthcare operations. They could not survive these cuts without making incredibly difficult decisions about what type of care they can offer their communities, leaving every single patient in the Commonwealth worse off. And we worry about the state of emergency care, because without the care that they need, many patients would be forced to use their local emergency departments as a first and last line of defense, which is not how the system was designed to work and is not a way for anyone to live. And in turn, wait times would skyrocket further. Overcrowding would become the norm, and the cost of everyone's care would go up. Our hospitals worry about their dedicated workforce, and many have alluded to layoffs as a painful but unavoidable step to keep their lights on in face of Medicaid cuts, which would mean the burden on every other caregiver would grow at a time in which burnout is already driving too many talented people out of the caring profession. Above all else, hospitals worry about patients. We worry about the patient who can't leave the hospital and return to their family because their outpatient treatment is no longer covered. They worry about the child unable to receive the insulin that they needed to manage their sickle cell disease, the countless emergency department visits that will be a future as their result, in their future as a result. They worry about the patient who may be unable to receive the inpatient behavioral health care after a suicide attempt because they were only eligible for those community-based resources. And we are here today to ensure that these hypotheticals do not become a reality. In Massachusetts, our world-class healthcare system didn't happen by accident. It's due to the types of leaders, caregivers, advocates, and elected champions with us here today. And it also relies heavily on Medicaid support, as does every system in our country, as Secretary Walsh noted. On behalf of every hospital, healthcare worker, and patient in Massachusetts, we are proud to defend this program and everything it represents for a functional, dynamic healthcare system that can meet everyone's needs, no matter who they are. Thank you. And now I'm proud to turn it over to Dr. Tracy Brooks.
Oh, so nervous. But I am Dr. Tracy Brooks. I'm the Chief of Pediatrics here at Cambridge Health Alliance, and I would really like to express my appreciation for all of your support, Congresswoman Clark and Secretary Walsh, in the care of our patients and communities. So thank you very, very much. I'm grateful for the opportunity to highlight the life-giving and life-saving role of Medicaid. Caring for children and their families, we see how truly essential Medicaid is to our patients' health and a healthy start in life. So many of our patients, from pediatrics to geriatrics and everybody in between, get life-altering care because they are able to receive Medicaid. It's critical for children with special care needs, and I would like to share a story of a particular patient that I have. He will be Jonas in the story. That is not his actual name, but we've altered it to protect his identity. He was born prematurely, and as a result, has significant health care needs. He's now a preschooler. He's 4 years old, and able to attend preschool here in Massachusetts because we have preschool. But because of all of that, and thanks to Mass Health coverage and care, he has required significant specialized treatment for pulmonary needs. He was born with significant respiratory issues because of his prematurity at birth, and he has now subsequently developed seizure issues, speech disorders, and is currently being worked up for autism spectrum disorder. Without Medicaid, he would not be able to receive any of these treatments. He is getting occupational therapy, he is getting physical therapy, he is getting a lot of support and help because of his special healthcare needs. With the ongoing treatments to support his growth and development, his health is now stabilized. He has significantly fewer school absences. And I gotta be honest with you, I love seeing him and his mom in the office all the time, but I'm not seeing them so much because he's getting the therapy that he needs and is thriving with this therapy. And it's all because he is able to have access to Medicaid. At CHA, our Medicaid provides vital coverage for, we've already heard this morning, but more than half of our patient care, specifically 80% of our newborn care, 78% of our children and adolescent care, and 75% of all our child and adolescent inpatient behavioral health care. Medicaid equates to health. Medicaid is health. Medicaid gives our patients the access to health. Potential federal Medicaid cuts will have very perilous consequences for the health of all our patients and the vital healthcare delivery system that we give them. So thank you all for speaking today, and there's a lot at stake. Let's protect Medicaid. And then next, I would like to introduce Sandra, who is going to speak on behalf as a patient and a family member to talk about how the impact that Medicaid has had on her family.
Thank you, Tracy. Good morning. I'm Sandra Valentini. I'm honored to share how important Medicaid is to my mom, Giovanna Valentini. Now 75, my mom worked all her life cleaning office buildings during the overnight shift so my family could have a good life. She's my role model with a huge heart. My mother was very independent, but that all changed once COVID hit. I thought I was going to lose her mentally and physically. She made frequent visits to the emergency department due to her heart issues and anxiety. My mother even considered a nursing home. My mother took care of me. Now it's time for me to take care of her. I am so thankful that she continues to live with me at home because of Medicaid PACE program at Cambridge Health Alliance. It brought my mother back. Since enrolling, she has coordinated healthcare and better everyday life through the daycare. It's a relief that she's taking care of while my sister and I are at work. It's such a beautiful feeling to see this wonderful turnaround in her health, in her outlook, since she's got this healthcare. When she's happy, it makes the entire family happy. As they get older, critical Medicaid support programs like these reassure them that it's going to be okay. We need to keep valuable Medicaid programs like this going. Please support Medicaid. Thank you.
Thank you so much, Sandra, and thank all of you, and we'll open it up to questions. They've already done it. They've already lined up and said they're doing it in the House, and he is in full support of it. So this is yet another wholesale lie he is telling the American people. They are very clear about their agenda, and they are putting it out there. And it has been backed up many, many times. The only way you get the $880 billion that they are going to take out of the system is through Medicaid. They've written it down. They voted on it, they're pursuing it, and they are doing it with the full blessing of the Trump administration.
Representative, does the Senate leadership have the leadership to sustain the Democrats in the next 3 years?
Let me tell you what we're doing today across the country with the Senate, with our governors, and with every House Democratic member. We are focusing on Medicaid and what these cuts mean. And if stories like Sandra about her mom, if the story we heard from William, another patient who worked as a chef for many years until he was not physically able to, and it is the PACE program that has not only restored his physical health, but his mental health so he can enjoy these years he met. The story of Edward that we heard, who was in a terrible car crash at 15, and through the help of CHA has addressed that traumatic brain injury and the trauma he suffered, and is now giving back himself, doing drama therapy for people who suffered like he did. If hearing those stories doesn't make you angry at the casual cruelty of coming in and saying that we will cut Medicaid, that we'll cut programs that feed hungry kids in this country, that we will cut veterans' benefits, that we will cut our public schools in order to do what? To give the very wealthiest Americans a tax cut. That's the whole game here, the whole scheme. If that doesn't make you angry, you are not paying attention. You know, I think what the American people want us to focus on is not the parlor game of who's in leadership. I leave those decisions up to the senators. That's who puts us in leadership positions. But I'll tell you what, every single Democrat has stood up to what this administration is doing, not only taking our health care away to pay for tax cuts, but the attacks on every other group. You know, the veterans alone, 7,000 veterans fired without cause. The 83,000 jobs they are planning to cut from our Veterans Administration, and military families and veterans who rely on Social Security, Medicaid, and Medicare. All of it is on the table for tax cuts. So yes, I will be in the fight with Democrats who are willing to stand up and say, this is unacceptable. The American dream belongs to taxpayers. I can let the secretary address exactly how the cuts might impact here, but let's just talk for a minute about how they are defining waste, fraud, and abuse. There isn't a single member of the Democratic Congress, or I doubt anybody here, who doesn't think our government can run more efficiently and do a better job at serving the people who pay their taxes for those services. But that's not what we're seeing. We're seeing a Doge operation that is going into our most secure databases that they don't understand, that they are not reading accurately, and taking our personal information and cutting people, not because they've looked and said we've identified waste, we've done audits, we understand. They're cutting people to cut people. And it's all written out in Project 2025. This is to impact people with trauma, to make this traumatic to work for our federal government. And it's not about defending an agency, but what does it mean to people at home? What does it mean to people at home when you say we are just going to take a chainsaw to Medicaid in order to pay for a tax cut for Elon Musk, who frankly won't even notice it, to Sandra's mom, and to Sandra, who is able to go to work because she knows that Medicaid is helping pay for this, for the care that her mom needs to survive and to thrive and to have the dignity in her later years that she deserves after working incredibly hard cleaning offices, sort of those silent workers that we don't see and appreciate. And the carelessness that the very wealthy in this country can treat people like Sandra's mom is something we have to stand up and fight for. If we don't, this is how we lose democracies. This is how we lose a country that is based on an American compact with taxpayers. That you work hard, you play by the rules, you should be able to get ahead, not be pushed behind by a billionaire in the billionaire class. I don't know, Secretary, if you want to.
No, I mean, I would just say that Medicaid is a state and federal program. It's a contract. And we have a contract with the federal government under this 1115 waiver. And what they're calling waste, fraud, and abuse are actually the terms of the contract they negotiate with us. And they're pointing to it because it has our waiver prominently mentions the word equity, because we want to ensure outcomes for people across our entire state. We want to ensure that health outcomes are equitable. That's now suddenly considered fraudulent or wasteful. So there's a lot of gamesmanship, there's a lot of words. I would really encourage people to, it's kind of wonky, I do this for a living, so I think it's interesting, but to understand how Medicaid is funded, what it pays for. I mean, our waiver in our state supports health-related social needs, housing, which is a very challenging problem in our state, food security, supports the hospital system, supports ambulatory facilities like the one we're in today. And so for them to say that's wasteful or fraudulent for Cambridge Health Alliance to be supported by the Medicaid program is just false. Sorry.
I mean, we obviously had a disagreement about where we are in looking at the the spending plan that was put forward by the GOP, the 7 month spending plan. But you're not going to find a single Democrat in Congress who thinks that these cuts to Medicaid are justified and are anything but cruel attacks on the deserving taxpayers who need them and who work hard to pay for them. And so, we are united in the work we are doing today in standing up against these particular cuts to our healthcare system. And we're seeing it across the healthcare system because you cannot, as Secretary Walsh pointed out, you cannot take away Medicaid and not have that impact Medicare. You cannot take it away and not have it end up being an increase in premiums that you get through a private employer. The system is connected. We can't take away over 80,000 employees from the VA and say all will be fine. That's not efficiency. That is taking a chainsaw to the fundamental services people pay for and deserve. Listen, we are barreling ahead together. This is one of the biggest issues we face. These attacks on healthcare, on Medicaid, on Medicare, and they are telling us every day that they're coming for Social Security. You've heard the quotes from Elon Musk. So we are united in fighting back. And we have said clearly to them from the beginning of this process, you put a budget in place that protects Social Security, Medicare, Medicaid, food programs for hungry kids in our public schools and our veterans, we'll run to the floor to come and vote for that. And at the same time, let's look at a taxation system where everybody pays their fair share. That's what people want. That's what Democrats are fighting for. And that's what unites us. Thank you.
Democrats can be more effective, though? That's what we're trying to find out. Do you think that something else needs to be more effective?
We have to use every single tool we have. And we've had a three-pronged strategy from the beginning of this administration. They are acting lawlessly. They are acting in defiance of the Constitution. So our first strategy point is to take it to the courts and work with outside partners in close coordination so that we are making them be law-abiding, because that is not what these executive orders are. This is not how we're seeing them run their budget process. And so that's our first. Second strategy is legislation, making sure that we are there opposing these cuts, that we are fighting for a taxation system that actually builds our middle class and strengthens it. The billionaire class has enough. They need to pay their fair share as we go forward. So we're going to use every legislative lever we have in the minority that comes from our unity. It's what you saw from the House last week to meet this moment for the American people. And the third strategy is mobilization, working with people around this country, working with organizations, working with CHA to bring these stories of what the work that is done in this incredible healthcare institution means to people, means to our neighbors, why it's a good value for our taxpayer dollar, and to use that public sentiment to bring change and to have the Republican Party understand that they think they have a mandate. Nobody voted for this. People voted to make sure that somebody was fighting for them. They voted for the promise that Donald Trump would come into office and fight for them, and that he'd reduce the cost of living for them. He'd make sure they could afford a place to live, that when they worked hard, they could get ahead, have success, not just scrape by. And since the day he took office, he's been doing just the opposite, only working for those who already have great wealth. That is not something Democrats can ever support, and we are going to continue to unite and fight to to make sure the American people are the ones that win. Thank you.
Good to see you.